Today for the next presentation we have among us wellness educator Dr. Vivek Modi. ये कुछ दिन पहले हमारे हेल्थ दरबार में आए थे एंड इन्होंने इच्छा प्रकट करी थी हार्ट रेट वेरिएबिलिटी पे एक डिस्कशन करने के लिए. So today he is among us and he is going to talk about heart rate variability and he's going to end with a few questions for Dr. K. Aggarwal. So I'll hand it over to Dr. Vivek Modi to present his views on heart rate variability.
Thank you, Dr. Meenakshi ji. Hopefully, I'm audible. Respected Dr. Aggarwal sir, thank you so much for giving me this opportunity. I'll just very briefly tell about what I do. I'm just very briefly to mention to give a perspective. So I'm a medical doctor. I've done my MBBS, and since 2010 till 2010, I worked in corporates. My last job was as a chief operations officer, and I'm of the view that
Haan ji.
our healthcare system has to be not just a disease centric, but it has to be a health promotion system in country like ours. So keeping that in mind, since 2010 I have been working full time as a wellness educator. Basically, in one line, if I have to say, I try to see that less and less people has to visit a doctor, or if they visit the doctor, they go for promoting their health and not just for a disease. Now, with that said, heart rate variability is a very, very fascinating thing, which I actually came across uh, just by chance. I was reading a book called Coherence. It is a book by Dr. Alan Watkins, which talks about leadership and how to maintain performance at peak for a long time. So in that, I came across one very fascinating thing, which actually gave answer to one of my queries. I have always wondered that we all have been doing pranayam for quite some time, but what was the medical mechanism by which this pranayam helps? So I was trying to look for that answer, but somehow I was not getting convinced by the proposed theories. But in that book, I came across this idea of heart rate variability. And if I may share an image, Meenakshi ji, can I make a presentation, a small image I want to share? Do I have the privilege to do that?
Yes, of course, you can go ahead.
Yeah. So hopefully it's visible. Yes.
Yes, it's visible.
Yeah. So I'll just directly come to the image which I wanted to discuss without getting into the other parts. This was the image. Now, in this image, Dr. Alan Watkins, very interestingly, he says that when we are excited with a positive emotion, our heart rate goes up. Similarly, when we are calm, very peaceful, happy, at that moment our heart rate goes down. Now, in the negative emotions also, heart rate can go up and go down. A depressed person may have a low heart rate. Similarly, a very angry, anxious person may have a very high heart rate. But what he said is there is a key difference between these two kind of heart rates, that whenever emotions are positive, our heart maintains its rhythm. And whenever emotions are negative, our heart loses the rhythm. And that was really very, very fascinating for me. So I started inquiring more about this subject, and I became very curious that why our doctors in India are not looking at this factor called heart rate variability. If it can do so many things, if it can help us to really improve our overall health in such a drastic way, why this explanation has not been given by medical doctors about how breathing exercises can help so much in improving our overall health, in improving our healing ability. So with that background, I did a little bit of study on this, and I have been teaching this aspect, whatever I could find as authentic work. Basically, I was looking at an organization called Heart Math Institute, and from there I got a lot of information about it. So I would just like to, for the interest of everyone, just like to mention a little bit basic about heart rate variability. What is heart rate variability? It is nothing but your physiological, it's a physiological phenomena of variations in the time interval between heartbeats. तो हमारा जो एक हार्ट बीट के बाद दूसरा हार्ट बीट आता है, अगर पहला हार्ट बीट 1 सेकंड में हो रहा है तो दूसरा इट कुड बी इन 0.9 सेकंड and third could be in 1.1 second. So there is this variation Overall, in a minute, we may have a 60 or 70 or 80 heartbeat, but in each second, with each heartbeat, our time interval varies. And the interesting thing is, this variation is normal. This is not what we call arrhythmia. This is a normal, healthy variation, which actually suggests our heart's ability to respond to the change. Our heart's ability to respond to the change. Suddenly, अगर किसी को कुछ ऐसा दिख गया जिससे उसको घबराहट होने लगे, तो heart will start pounding, heart will start racing fast. So does heart have the does your heart have that fitness कि वो एकदम से respond कर सके एक situation को? और ये ability जिसकी जितनी ज़्यादा है, it shows that that person has a good self control. अब हार्ट रेट वेरिएबिलिटी से क्या क्या चीजें प्रिडिक्ट कर सकते हैं? सो व्हाट आई फाउंड, देयर आर एक्चुअली सो मेनी थिंग्स. देयर आर लिटरली थाउजेंड्स, नॉट थाउजेंड्स, lakhs of citation about heart rate variability. So many studies are going on. So there are few things I would like to mention. What does it indicate? Your heart rate variability, if it is high, मतलब अगर आपका HRV हाई है तो आपका ओवरऑल हेल्थ अच्छा है. इट शोज योर मॉर्बिडिटी एंड मॉर्टेलिटी प्रिडिक्शन. यार आप कितना ज्यादा जियोगे, कितना हेल्दी जियोगे, it is an indicator of that. It also talks about the balance between your autonomic nervous system. There are two branches of autonomic nervous system: sympathetic nervous system, which helps you to get excited, fight and flight reaction, and parasympathetic nervous system. Dr. Aggarwal has mentioned it various times in his talks. Parasympathetic nervous system is rest and digest, healing system. Now, in present day life, majority of the people have hyperactive sympathetic nervous system. That means we are always in fight and flight mode. We are always anxious and rushing in the life. And because of that, parasympathetic system is lagging behind. So we have less of healing in the body. हमारा sleep भी कम हो गया है. We get less rest. And when parasympathetic nervous system is working very less, our healing capacity reduces. Then our all chronic lifestyle related diseases like diabetes, hypertension, high cholesterol, सबका चांस बढ़ जाता है. ये सारी chronic diseases है जो जिसमें inflammation is a basic factor. So the third thing is, it also shows about healing capacity. अगर किसी को कोई chronic disease है and if he tries to improve his heart rate variability, then it would suggest that with increased heart rate variability, his healing chances improves. Better self-control. Now, I was reading a book called Willpower Instinct, and in that I again found heart rate variability. Very interesting fact that अगर आपका heart rate variability ज़्यादा है तो आपका self-control अच्छा है, आपका willpower भी अच्छा होगा. So in Western countries, in some of the places, when a person is getting released from a de-addiction center, जैसे किसी को नशा मुक्ति के लिए सेंटर में है और जब वो जा रहा है वहां से, that time they see his heart rate variability and they predict कि अगर हार्ट रेट वेरिएबिलिटी उसका अच्छा है तो ही इज अनलाइकली टू कम बैक. लेकिन अगर उसका एचआरवी कम है तो हिज विल पावर इज लेस, देयरफॉर ही कैन अगेन गेट इनटू दैट अल्कोहलिज्म और ड्रग एडिक्शन. सो इट कैन आल्सो प्रिडिक्ट योर सेल्फ कंट्रोल. फिर नेक्स्ट चीज इज योर रेजिलियंस टू स्ट्रेस. A lot of application of heart rate variability is happening in looking for the people with depression. It's a good measurement of level of stress in the body. तो जिसको डिप्रेशन है, एंजाइटी है, उसका भी अगर एचआरवी बढ़ाने की कोशिश करेंगे तो दैट पर्सन इज लाइकली टू रिस्पॉन्ड बेटर. इसके अलावा लॉट इज यूज्ड, एचआरवी का यूज बहुत ज्यादा होता है वेस्टर्न कंट्रीज में. एथलेटिक्स, जो एथलीट्स है सारे, अ फन फैक्ट, लियोन मेसी जो है लेजेंडरी फुटबॉलर मेसी, उनके कोच उनका हार्ट रेट वेरिएबिलिटी डेली चेक करते हैं because they see how much he has to train. You know, heart rate variability अगर गिरने लगता है इसका मतलब he is getting into fatigue. तो उसका ट्रेनिंग कितना करना है इसका डिसीजन लेने के लिए हार्ट रेट वेरिएबिलिटी becomes one of an important parameter. तो जब इतने सारे ड्रास्टिक इसके यूजेस है, और भी बहुत सारे हैं, इन इंटरेस्ट ऑफ टाइम आई विल नॉट गो इन डिटेल. आई वुड लाइक एक्चुअली टू हियर फ्रॉम डॉक्टर के अग्रवाल मोर ऑन दिस. तो मैं इसके बारे में बहुत ज्यादा मतलब पता लगाने की कोशिश कर रहा हूँ. I couldn't find any standard center in India which is measuring heart rate variability. It is not that difficult to measure, at least from one lead. So आजकल तो Apple Watch में भी heart rate variability आता है, but we are skeptical how standardized or how good it is. We do not know. बहुत सारे devices बिकते हैं Amazon पे, और foreign countries में तो लोग use भी करते हैं. And just through a mobile app, they can check their heart rate variability and then they track it. But it still lacks that standardized formats, values, and all that we do not have. So medical doctors are a bit skeptical in using it in daily practice. But I have a strong feeling that it should be used more, because even though we may not have a standard parameter of that, but if we have the baseline of someone's heart rate variability and if we increase it, that would be actually a good thing. Now there is one more table. I'll share that and I'll close my presentation. Now this is another fascinating table from that book called Coherence by Dr. Alan Watkins. And what does it tell? It tells about why pranayam, breathing exercises, are important. Okay, and it talks about 12 important parameters during your doing pranayam. Why pranayam? Because आप जब pranayam करते हैं, if you do it in a right way, you actually can improve your heart rate variability. कितना time लगेगा? So there are few data about that. They say that 5 to 6 week अगर आप daily 10 से 20 मिनट करेंगे, up to 5 to 6 week, तो आपका जो baseline HRV है वो लगभग 30% तक बढ़ सकता है, provided you do it properly, you do it in the rhythm which suits you. Okay? तो नॉर्मली ऐसा देखा है कि लोगों का हार्ट रेट वेरिएबिलिटी इट वेरीज समवेयर बिटवीन 50 to 70. ओके, एवरेज वो बताते हैं 59 तक है. तो जितना ज्यादा है उतना अच्छा है. देयर आर सम पैथोलॉजिकल कंडीशंस, वहां पर हार्ट रेट वेरिएबिलिटी ज्यादा होता है, बट इट डजंट इंडिकेट द राइट थिंग. वो एक एक्स्ट्राऑर्डिनरी सिचुएशन होती है. बट मोस्ट पीपल, अगर आपका एचआरवी ज्यादा है तो आपका ओवरऑल हेल्थ अच्छा है, यू विल लिव लॉन्गर, यू विल रिस्पॉन्ड बेटर टू एनी कार्डियक इवेंट. These are the things which are popular. उसके अलावा with the age, as the age increases, your heart rate variability actually reduces. Okay, अब इसमें important factor मैं mention करके इसको close करूंगा. The most important factor while doing pranayam is the rhythmicity. आप कितना rhythm में करते हैं. Actually pranayam का जो discipline है वो it is in the rhythm. When you're breathing in and breathing out, can you maintain that ratio consistently over next 10 or 15 minutes when you start doing it? और इसका जो हार्ट रेट वेरिएबिलिटी का बारे में जो पता भी लगा था कि इट इंक्रीजेस, इट वाज एक्चुअली they came to know about this use of pranayam is when they tried to check HRV of the yogis, expert yogis. तो जो वेस्टर्नर्स थे रिसर्चर्स, दे केम टू योगीज एंड दे चेक्ड देयर हार्ट रेट वेरिएबिलिटी एंड दे चेक्ड व्हाट वी कॉल इज बायोफीडबैक. You know, you provide all these parameters, you check continuous monitoring of your blood pressure, heart rate, and various other things, body temperature, and then they tell them to do a particular kind of meditation or yoga. And they saw the moment the yogis went into a particular breath rate, a particular breath rate, usually it varies between 4 to 7 breaths per minute. At that moment, their heart rate became very, very rhythmic for that particular time, and it improved the HRV. So this became actually the reason for the research, and a lot of research has happened. It's a very, very complex field. The more I read, actually it confuses sometimes. But rhythmicity is important. That is one important factor when you do pranayam. Then smoothness. So technically Kapalbhati pranayam may not be very good for HRV, because Kapalbhati pranayam is a jerky pranayam. Whereas here Dr. Alan Watkins says that you have to be very smooth in this. So Kapalbhati pranayam is for a different purpose. Then focus on heart, speed and pattern. तो ये बहुत सारी बाकी चीजें हैं. I will not go into details of it in interest of time. So with this, I would stop my presentation. Thank you so much once again. My hearty thanks to Dr. K.K. Aggarwal ji for giving me this opportunity. And now I would like you to speak for some time on this. And then I have few basic questions which I would like to ask you. Thank you so much.
Heart rate variability came into picture with the Holter monitoring. 20 years back, the Marquette company wanted to bring Holters with heart rate variability, but somehow or other it could not be standardized. But they wanted to come back with the sophisticated ways of measuring various parameters of heart rate variability. Being in India, we shifted to Jugaadu way of heart rate variability, and we started doing autonomic function tests. So we converted heart rate variability as a part of autonomic function test. And then we worked with a couple of companies in making adjusting heart rate variability in a lead ECG done in 1 minute. So what we would used to do was to check the difference of heart rate between inspiration and expiration. So normal inspiratory, expiratory heart rate difference we used to calculate. And then we used to say that the difference between inspiration and expiration is the heart rate variability. That's how we started doing it. Then we developed a Valsalva maneuver that we do a Valsalva 2 and Valsalva 4. And then we brought out with lots of variations into, then we brought out a parasympathetic system test by standing, sitting, blood pressure difference, inspiration, expiration, heart rate difference, 10:30:15 ratio. So all those ratios came as a part of autonomic nervous system. Now what happens is that if you lose your heart rate variability, then you will shift to sympathetic overactivity. We call them as parasympathetic dysautonomia. So the first thing will be that if you develop, so all those patients who develop, so we started looking in diabetics. So agar unka heart rate tachycardia hai, so we did a heart rate study of 1 lakh people with Eris pharmaceuticals, and we found that the average heart rate of the people has gone up. That means the average heart rate of the people is around 90. That means people are now living into sympathetic overtone. And with this sympathetic overtone, your heart rate variability will go down. And whenever you do slower and deeper breathing, your heart rate variability will improve. That's how the pranayama works. And that's how, when I say pranayam ko 2 se 3 per second per minute karo, and that's the reason I brought out the concept of कि 4 चौपाइयों को एक सांस में करो ताकि आपकी heart rate variability बढ़े. Now what we are seeing in COVID-19 is, COVID-19 के अंदर में there is research inappropriate sinus tachycardia. Now this inappropriate sinus tachycardia basically means these patients suddenly develop sinus tachycardia, and how do we detect? Loss of heart rate variability. इनके ऊपर में अगर आप ECG में नापोगे तो ये सारे कोविड के पेशेंट्स में जिनको इनएप्रोप्रिएट साइनस टैकिकार्डिया हो रहा है, actually it is a COVID induced autonomic neuropathy which happens in diabetes. And now we know when we do a ECG rhythm and we give them, because autonomic function test I am doing in diabetic patient as a routine. Every patient we undergo a diabetic, but we have never seen improvement and how much improves over a period of time. But we know that if there is a reduced heart rate variability, your chances of sudden death are very high. So we basically take it as a prognostic feature in them. And meditation, relaxation, pranayam, everything helps in rebuilding the autonomic functions. So this is basically a marker of autonomic functions. Yes, beautiful presentation by Dr. Vivek concept. Keep it up. इसके ऊपर में मास्टरी करो, एक ही चीज पे लग जाओ. And heart rate coherence and heart rate variability is, we have been using it more in the patient care than we have not gone into the theoretical aspects of it. So normally बच्चों में साइनस अरिथमिया होता है, बच्चों के अंदर में हार्ट रेट वेरी करता है, फिर हम बोलते हैं एक्सैजरेटेड साइनस अरिथमिया. बड़ों के अंदर में साइनस अरिथमिया धीरे 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 खत्म होके वो साइनस वेरिएबिलिटी में चला जाता है. तो रिमेंबर, पैरासिम्पैथेटिक अगर आपकी रिस्पांस है तो हार्ट रेट वेरिएबिलिटी ज़्यादा आएगी. जैसे जैसे आप सिंपैथेटिक ओवर ट्यून में जाएंगे, अगर आपको पीएटी हो जाए तो साइनस हार्ट रेट वेरिएबिलिटी में रिड्यूस, बिकॉज हार्ट रेट बढ़ गया, सिंपैथेटिक ओवर एक्टिविटी में है. सो हार्ट रेट वेरिएबिलिटी बेसिकली टेल्स यू योर पैरासिम्पैथेटिक स्टेट ऑफ माइंड. जो मोदी जी ने, विवेक जी ने कहा था कि हमारे पुराने जमाने के जो वैद्य नाड़ी देखते थे, उनकी नाड़ियों में वो पैरासिम्पैथेटिक, वो हार्ट रेट वेरिएबिलिटी भी देखते थे, बट उसके लिए वैद्य का पैरासिम्पैथेटिक स्टेट में होना जरूरी है. हम सारे लोग सिंपैथेटिक एक्टिविटी में हैं, इसलिए हम लोग नहीं पकड़ सकते, बिकॉज हमारे पास में वो पेशेंस ही नहीं है कि हम हार्ट रेट वेरिएबिलिटी को बिना किसी मशीन के देख पाए. क्योंकि उसके लिए अगर हम ही लोग सिंपैथेटिक फेज में हैं तो वी विल डिपेंड अपॉन द मशीन्स टू मेजर द हार्ट रेट वेरिएबिलिटी. आप अपने सवाल ले सकते हैं विवेक जी.
सर एक्चुअली माय मोस्ट ऑफ क्वेश्चंस यू हैव आंसर्ड, पर एक और क्वेश्चन है कि डू यू सी अ स्कोप ऑफ इंक्रीज्ड यूज ऑफ एचआरवी? शुड वी प्रोपोगेट इट एंड एनकरेज डॉक्टर? जैसे आप सीआरपी का कर रहे हैं, मैं
अभी
देखता हूँ
अगर
यहाँ
आप
बहुत सारे डॉक्टर सीआरपी अभी भी यूज नहीं कर रहे हैं।
heart rate variability, I am doing it in my practice for the last 20 years as a autonomic function test. But yes, we can, because yesterday also in the 9 p.m. show, I talked about heart rate. I talked about autonomic functions, how to detect. In fact, I take workshops in teaching people कि autonomic function test को जुगाड़ू कैसे टेस्ट करें without any machine measuring it. हम लोग तो वेलसेल्वा का इस्तेमाल करते हैं and to find out the difference. And we normally say heart rate variability of up to 10 is normal between inspiration and expiration. So what we do here, all my technicians are trained in doing it. So we make the patient lie down. First of all, we ask them to take a normal respiration and we take a long lead. Okay. Then we calculate the RR interval between the inspiration and the expiration. So their job is just to label. Heart rate and during inspiration and a normal inspiration and a normal expiration. Then we calculate the heart rate and we write down the difference between inspiratory and expiratory heart rate is so much. The second test we do is we do a Valsalva. So with the Valsalva, we see phase 2 Valsalva, the tachycardia should increase. And in a phase 4, the heart rate should drop. So we calculate the difference between phase 2 and phase 4. And then we have the parameters to calculate the autonomic dysfunction. And then we see kitna improve ho raha hai. The third test we do is standing. लेट के ECG किया और खड़ा कर दिया and उसकी 30:15 beat की ratio निकालते हैं. So these are heart rate variability means if you have a dysautonomia, the heart rate will not vary at all. But what we want to pick up is early dysautonomia. See, इस एक बार अगर वो इस स्टेज पे पहुंच गया कि हार्ट रेट वेरी नहीं कर रहा, तब आपके पास कोई इलाज नहीं है. So we are looking for a earlier stage जिसके लिए हम ये autonomic function जिसको हम बोलते हैं parasympathetic dysautonomia कि variability has gone down, उस स्टेज में हम उसको रोकने की कोशिश करते हैं. So basically the role of pranayama and meditation comes is we shift them. Our basic objective is to lower their heart rate. So इसमें आप देखिए कहीं ना कहीं मिलेगा बीटा ब्लॉकर also increases heart rate variability क्योंकि आप उसकी sympathetic activity कम कर रहे हैं. So heart rate variability has gone to life coaches and all wellness centers because that gives you a demonstration that you are in a parasympathetic state of mind. That's an objective criteria of a parasympathetic mind. तो आप सब लोगों को हम लोग क्या करेंगे? Let me work out. जब हमारा जो स्पिरिचुअल रिट्रीट कर रहे हैं हम तारीख निकाल लीजिए, उसके अंदर में विवेक जी को भी साथ में ले लीजिएगा. तो हमारा जो एक दिन का स्पिरिचुअल रिट्रीट का प्रोग्राम है उस दिन आई एम इवन वर्किंग ऑन कि SpO2 मॉनिटर से हम हार्ट रेट वेरिएबिलिटी कैसे कैलकुलेट करें विद वेलसेल्वा. सो नॉर्मली आई एम नॉट टेलिंग पीपल टू डू इट. जो हम उस दिन करेंगे, आप SpO2 मॉनिटर लगा लो, वेलसेल्वा करो. तो वेलसेल्वा के लिए हम बीपी इंस्ट्रूमेंट से या जो PSVT का वेलसेल्वा मैन्यूवर है वो करा के एंड देन यू सी कितना हार्ट रेट बढ़ रहा है एंड देन छोड़ने के बाद में कितना हो रहा है, दोनों का डिफरेंस कैलकुलेट कर लो. So that will give you the difference between phase 2 and phase 4, and that difference will tell you the gradation classification of heart rate variability. इसके ये क्योंकि हम लोग प्रैक्टिकल करते आए हैं, theoretically let me go into it. Let us make a protocol. उस दिन जब हम spiritual retreat करेंगे, let us see हम लोग पूरा फॉलो करेंगे. Let's see कुछ improvement होता है कि नहीं होता. But I agree with you, but I will definitely आप यहाँ पर रोज आए and every day we will let us calculate the एक पेशेंट का जब जो अशांतस्य कुतो सुखम जो अशांत आदमी है उसका हम हार्ट रेट वेरिएबिलिटी निकालेंगे और जब उसके क्वेश्चन का आंसर मिल जाता है फिर देखेंगे कि उसकी हार्ट रेट वेरिएबिलिटी ठीक हुई कि नहीं हुई. ये तो क्लासिकल एग्जांपल है, हम यहीं पे कर सकते हैं. सो वी कैन आस्क हिम कि SpO2 मॉनिटर यहाँ सामने सरफेस पे दिखाओ. So we can take a screenshot, फिर उसके आंसर को शांत करके देखते हैं फर्क पड़ता है कि नहीं पड़ता. Now these are the researches which has to be done in India because अमेरिका वाले तो मशीनों के ऊपर में काम कर रहे हैं. So we have to find out jugadu ways of finding heart rate variability. Thank you, Vivek ji.
Sir, may I ask one more question?
Yes.
सर आजकल जो डिवाइसेस अवेलेबल है ऑनलाइन वगैरह एंड इवन दिस हार्ट मैथ इंस्टीट्यूट इज प्रोवाइडिंग फ्यू डिवाइसेस एंड दे आर नॉट एक्चुअली दैट एक्सपेंसिव, सो डू यू सी अ केस फॉर देम टू बी यूज्ड इन डेली प्रैक्टिस?
कोई एक मशीन है तो मंगा लीजिए, यू ऑर्डर दैट मशीन ऑन आवर बिहाफ. कितने की आती है मशीन?
उसमें अलग अलग है, कुछ लगभग 40-50 हज़ार तक है एंड इट स्टार्ट्स फ्रॉम $100.
इंडिया में मिलती हैं?
आई हैव टू सी इट.
आप उसको देखिए. विल बाय दैट वन इन माय रिसर्च फंड. So we will buy that in my research fund, and let's start doing it and practically demonstrating it in here.
Fine, sir. Thank you so much for this time.
Let's start buying it and see. मैंने आपको सुबह भी ये कहा था कि हम लोग evidences पे नहीं जाते. We don't go into. I don't believe in double blind studies. इसमें किया, इसमें नहीं किया. So I believe in प्रत्यक्ष. प्रत्यक्ष is we practice and we discuss and we observe. तो अगर मान लीजिए यहाँ पे उस मशीन से हम 50 लोगों पे करते हैं और ऑब्जर्व करते हैं, दैट इज मच मोर सिग्निफिकेंट देन आधों में किया आधों में नहीं किया. सो आई बिलीव इन प्रत्यक्ष बिकॉज प्रत्यक्ष गिव्स यू ए फीलिंग, कॉन्फिडेंस of doing it on your patient. So anything which is not harming, yes, we'll do that. So give me a presentation tomorrow, which are the machines. So we will order them, let the machine come.
Sure, sir. Thank you so much, sir.